Hello, everyone. A very good morning to all of you. So today we are going to talk about the EORTC risk stratification for non-muscle invasive bladder cancer. This is a very important topic when it comes to the Section 1 exam and also for Section 2 FRCS Urology exam. Now, there are a lot of confusing things in this because there are a lot of numbers, a lot of percentages when you talk about the EORTC risk stratification. So I'm here to make things simple for you, at least for the MCQs. So when you come across a question on EORTC risk stratification and what is the risk of progression and recurrence based on the EORTC risk, you would be able to say uh, confidently the answers. That's very important. So let us start by understanding what are the parameters included as a risk stratification system. So if you look at this risk stratification system, it is EORTC. So I'll try to make things simple for the ability to remember facts, numbers, and percentages. Now, when you write EORTC, the parameters hides in the name itself. So you can just write down the R for recurrence. So write down R as a recurrence, where you write the N in capital, R in capital, and you replace the C with an S. So this is recurrence. Now, why is this important? Because the R itself makes it a number of recurrence in a year, N stands for number of tumors, and S stands for the size of the tumor. There's very important reason why we are writing this way. So recurrence in a year, number of tumors, and the size of the tumors. The T itself stands for the T stage, and the stage always comes with a grade. So T and the grade, and C stands for the CIS. So these are the 6 parameters included in the EORTC classification. So R stands for recurrence in a year, N for number of tumors, S for size of the tumor, T stage, grade, and C for CIS changes. So all this actually decides your progression and recurrence risk. Now, there are a lot of complex numbers allotted to each parameter to decide which tumor or which parameters are more likely to contribute in the progression and recurrence. We'll try to make things simple for you again. Now, if you look at this, now I'll just write it again for you to make things simple. Suppose you're writing it again, and this time you're again writing it as EOR. Now this time you're writing it as recurrence. N is for number of tumors, and S is for size of the tumors. Okay, and then you are writing the T here. T is for T as well as the grade, and then comes the CIS, which is the carcinoma in situ. So now this very important thing to understand. Number one, when you go through this first 3 parameters, the recurrence, number, and the size, and the next 3 parameters, T, grade, and CIS, all have important implications in the allotment of the score. I'll tell you how. Now we are going to discuss how these parameters actually contribute to the progression risk and the recurrence risk. So if you look at the progression risk here, and you write the recurrence risk here. Now you are basically going to calculate the score. Now just write from top bottom in the progression. So we are going to talk progression first because P comes before R. The alphabet P is before R, so we're going to talk about progression. And also, whenever you talk about the percentages of what is the 5-year progression rate, 5-year recurrence rate, always remember the 5-year progression rate is going to be much, much less than the 5-year recurrence rate because the alphabet P comes before R. So R is going to be more than the P at any score, for any score, okay? Now for progression, let us take a progression. If you have to allot the score, just remember the numbers from top to bottom: 2, 3, 4, 5, 6. So you allot the number 2 for the number of recurrences in a year, a number of tumors you allot 3, size of the tumors you allot 3, T you allot 4, for the T stage you allot 4, for the grade you allot 5, and for the CIS you allot 6. So it is 2, 3, 4, 5, 6 from top to bottom, and this is the reason why we're preparing like a, this sequence is important for us: recurrence, T, and C. Okay, now see, one important thing is you can understand by looking at these numbers that the factors which most importantly contribute to the progression are the ones which has higher number. So the factors which most importantly contribute to a progression of the tumor to a muscle invasive or a higher stage tumor is actually the existing T stage, the grade, and the CIS. So the T, grade, and the CIS are the most important factors predicting the progression of the tumors. Okay, so if you talk about the recurrence of the tumor, these are not the most important factors which predict the recurrence of the tumor. So if you have to number the same parameters for the recurrence of the tumor, you will see that it's not the CIS which has the highest number. It's not the grade which has the highest number. The recurrence of the tumor actually depends on the parameters, how many times the patient already had a recurrence. If the patient already had a recurrence at least once, twice, yours, the highest score would be multiplied by 2. So you just multiplied by 2. The number of the tumors, if it is 8 or more, the number of tumors increases. You again multiply it by 2 and you make it 6. So the highest score for recurrence is actually allotted to the number of tumors, the recurrence of the tumors previously. The size itself actually shares a similar criteria in both the progression and the recurrence. So it's an equivalent contributor in both the recurrence and the progression. I hope you're able to understand what I'm trying to convey. If ever you are getting a question on NMIBC and you are going to predict which parameters are actually going to progress into from NMIBC to MIBC and which parameters actually going to progress or recur, is different. Okay, so the factors which help in progression of the tumor or which actually leads to progression of the tumor are T stage, that is T1, grade 3, and CIS. Okay, so this is very, very important. And the factors which contribute to recurrence of the tumors are different from this, which is recurrent tumors already, number of tumors, and size itself is a contributor in both. So it's 3 in both. Okay, now once we know, now you understand one more thing from here. The number of factors which actually contribute to progression are more than the number of factors which contribute to recurrence. So you can see that there are at least 3 factors which contribute to progression plus 1. That means the size. Size is in both the criteria. So 3 plus 1. And the number of factors which contribute to recurrence are 2. That is, R and N, and size is also there. So it is 2 plus 1. So there are 3 factors in recurrence and there are 4 factors in progression. So if you have to calculate a progression score, you expect that the progression score is going to be at the higher number. That means you can have progression score maximum going up to 23. And the recurrence score, when you read it, you will understand, okay, the recurrence score cannot go to 23. It has to be somewhere lower than the progression score and it would be around 17. So you usually read the recurrence score between 0 to 17, the progression score from 0 to 22, and there's a clear reason for it, because the number of parameters contributing progression are more than the number of parameters contributing recurrence. Very important. Guys, when you go through this, try to remember this way. It's going to help you in at least finding out how many parameters the scenario given in your exam has that leads to progression. How many parameters in the scenario has that leads to recurrence. And it's very easy for you to calculate the progression rates and the recurrence rates when you have that. I'll tell you, make things very simple, but before that, look at this. Please look at this. So this is what we were talking about. We have just changed the sequence. We have brought the progression and prior recurrence rate as the number 1 top. Okay, and then we have gone to the number of tumors, the size of the tumor, and then we have made this 3, which you can see easily that they are contributing to progression. So we are not going to look at this now. This is going to make it more, no, just have it, make it in your notes, write it in a way that you know the sequence and know why the progression has a total value of 23 and the recurrence has a total value of 17. You know it very clearly. Okay, now once you get the score, once you have an idea how many parameters given the question have a progression related parameters, how many are actually related to recurrence. Okay, you have some idea. Now let us see. Again, I'll write down things for you. This is the progression table and this is the recurrence table. Okay, so the progression table is going to have, so I'll just write the parameters for you. So it's a recurrence in a year, number of tumors, the size of tumors. Okay, the size is an overlapping thing in both. And then comes you have the T, which comes with the grade, and then comes the CIS. Okay, so these are the 6 parameters that you need to know for a EORTC. Now, if you look at these parameters, the T, grade, and the CIS are the ones which mainly contribute to progression. So it will be 4, 5, and 6. The numbers will be the highest score given to them. Okay. And for the recurrence, it is just the other way. You give this as the highest score of 4 and number of tumors you give at a 6. And then you have this as an equivalent score of 3 for both. And then you have different score. Now, it's not possible for you to remember or calculate the score when you get the question. Nobody expects you to do that. What is more important for you is you find out, as per the question, does the patient has any risk factor or not? Let us first talk about the progression, because P comes before R, so we are going to talk about progression always first. Now, if you look at the progression, Now, looking at the progression rates, suppose the patient, you get a scenario where the patient doesn't have any progression, doesn't have any risk factor, may have one risk factor, may have two risk factor, or may have three risk factor. Okay. Now, when we talk about risk factor, we are mainly talking about the last three. Now, suppose the patient doesn't have any out of all, so it is zero risk factor. Then you give the patient has a 5-year progression rate of 1%. When you find that out of these three, the patient has one risk factor, that is either T1, the patient has a grade 3, or patient has a CIS. Any one risk factor, then you level the patient has a 5-year progression rate of 5%. You find two of these risk factors are there. Okay, then you level the patient has a risk of 15% 5-year progression rate. And when you have all three risk factors there, you make it 45% 5-year progression rates. Very, very important. Okay, so the why I'm saying this actually puts you into a score group. If you have two categories, then it will be around score of 9, 10. That will make it a 15% risk. If you have three, then the score will become around maybe 15. So that will be around 45%. So this basically, when you get a question, you're going to look at how many parameters, how many high-risk parameters are there. High risk for progression, high risk for recurrence. If you find none, all are zero, then it is 1% 5-year progression risk. If you have one parameter, then it is 5%. Two parameters is 15%. Three parameters is 45%. Risk of progression. We are just talking about progression now. Now, one very important difference between progression and recurrence, which we just discussed for your exam. Now, suppose you have the same scenario, you are going to talk about the recurrence risk, 5-year recurrence risk. Now, 5-year recurrence risk is basically, recurrence is always more than the progression rates because R is a bigger alphabet. It comes after P, so it's going to be more. So when you have no risk factor, even in spite of zero risk factor, the 5-year recurrence risk is going to be 30%. When you have one risk factor out of this, then it becomes around 45%. When you have two risk factors, it becomes around 60%. And when you have more than that, it becomes a 75%. So it's just an addition of 15. Okay. And so I hope things are making simple for you. How do you predict the 5-year recurrence rate? How do you predict the 5-year progression rates? These are very simple. You should know which parameters to look for actually when predicting the recurrence. You should know which parameters to look for when you are actually predicting the progression. Okay, now let us carry on further. If you look at further, though this is what the recurrence rates and progression rates sound like. So the first thing that we discussed for the progression rate, now very simple. It's around 1%, 5%, 15%, and 45%. Very simple. Now, the 5-year recurrence rates. 5-year recurrence rates, even if there is no risk factor, it's 30, then it becomes 45, then it is 60, and then it is 75. So this is how the 5-year recurrence rates go. This is how the 5-year progression rates go. Okay, so the whole idea is to make it clear which parameters you're supposed to look when predicting the recurrence and progression, and how do you make these parameters easy to apply for your MCQs. Now, many people confuse between EORTC and the EAU risk stratification and its risk of progression. I'll tell you one thing very clearly. When you talk about the EAU risk stratification into low, intermediate, high, and very high risk, those risk stratification is risk of progression, not for recurrence. So when you look at this, the EAU risk stratification system is mainly to predict the risk of progression into one of next stage, that is a muscle invasive bladder cancer. So this is how this is different from the EORTC. EORTC predicts both the recurrence and the progression. The EAU predicts only the progression. It's very, very important. Now, when you look at this EAU, suppose you have a scenario on very high risk. Very high risk means the patient is having all the three parameters again. We go back. What do you mean by EAU very high risk? EAU very high risk means the patient has a T1, the patient has a G3, the patient has a CIS, along with that one high risk factor like an age. So if you have all the three factors, you level the patient into EAU very high risk. EAU very high risk, what is going to be the 5-year progression rates? All the three parameters are there, it is going to be around 45%. Let us go back and look at this EAU table. EAU very high risk group, what is the 5-year progression rates? Very high risk groups, it is 40%. So this is how you can just remember one thing and apply on all your MCQs, all your Viva scenarios. No need to go through a lot of numbers. Keep things clear, concise, and know what actually predicts the recurrence, what actually predicts the progression of the tumor into upstage, next stage, or the muscle invasive. And I'm sure that things will be easier for you. So it's very simple. So all that you have to do is just quickly just brush up all the thing. So first, all that you have to do is when you see a scenario, just remember the risk factors. EORTC is the best way to classify the risk of progression and recurrence. And what you have to do is break the R into recurrence, and this N is capital. You replace the C with an S, and this becomes the number of recurrence in a year, the number of tumors, and the size of the tumors. Okay, the T is the T stage, and it comes with a grade, and C stands for a CIS. So you have the 6 parameters here, very straightforward. To predict the risk of progression, these are the 3 parameters, and you level them as a score of 4, 5, 6. And to predict the risk of recurrence, you have the first 2 parameters, you give a score of 4 and 6 to them. Size is included in both with a contribution of 3 as a cutoff and 3 as a size, maximum size given a score of 3. The progression has more parameters, so it's going to be maximum score of 23 for EORTC. For recurrence, it has less number of parameters, so the maximum score is going to be around 17. Now, irrespective of what the parameters, just when you read the question, find out which has a higher risk, and then you calculate. And suppose it's very simple, you write the progression risk here, 5-year, and you write the recurrence risk here. If you don't find any risk factor in the question, still the progression 5-year will be 1%, the recurrence would be 30%. If you find one risk factor for progression, it becomes 5% progression rate if one risk factors are present. If you find one risk factor for recurrence, it becomes 45%. If you find 2 risk factors for progression, then it becomes 15% 5-year progression risk. The recurrence similarly becomes 60%. And if you find all the 3 risk factors are there, you make it a very high risk EAU, which is equal to EORTC. All the 3 parameters are highest score, which is the 45%. And it is going to be 75% for the, 75% for the recurrence. So the take-home message is progression rates are always less than the recurrence rates because the alphabet B is smaller than alphabet R. It's very simple, irrespective of if you have any risk factors or not, the recurrence rates is always going to be starting from 30% at least. Okay? And what are the factors which contribute to recurrence? What are the factors which contribute to progression? I hope you find this useful. I hope you apply this to your exam, in your MCQs, in your Viva. And you don't have to memorize the numbers, just understand how to remember this concept. Thank you so much.